We begin a new series this morning called In Your Genes. Our Dr. Jennifer Ashton is here with a look at some of the amazing new genetic advances out in the world. Good morning.
Good morning to you, Harry. Since mapping the human genome was completed in 2003, researchers and doctors have found ways of translating discoveries into clinical applications to benefit patients. Now, once hard-to-detect diseases are being treated.
Can you tell us when it gets to be too much?
Sharon Brown is running for her life. A breast cancer survivor, Sharon is at the Mayo Clinic to endure a new round of clinical tests for a rare heart disease that affects 1 in 4,000 Americans. It's called long QT syndrome.
182.
The first visible symptom is often sudden cardiac death.
Whew, I'm going to check your blood pressure again.
My dad died fairly young of a sudden heart attack at age 56, and his dad did too.
Today, doctors can combine Sharon's family history with genetic testing to better determine her risk for having the disease.
We're really now doing personalized genomic medicine for this disease of long QT syndrome.
Dr. Michael Ackerman is a pediatric cardiologist who helped develop a genetic test for long QT syndrome.
Hi.
Nice to meet you.
Nice to meet you.
It really has been a wonderful story from bench discovery to translation to patients and to actually availability to patients.
This genetic test may save Sharon's life because her results identified a mutation on chromosome 3 and the gene named SCN5A, a marker for type 3 long QT syndrome.
Squeeze.
Because the disease is hereditary, Sharon's children are being tested too.
We found the cause. This is X marks the spot. Now it actually becomes very simple to determine whether her 2 sons are among the haves or the have-nots.
If they do have it, I'm confident that they will be treated and can live normal lifestyles, and that's what is so wonderful about genetic testing.
Treatment for Sharon will likely include surgery for an implantable cardioverter defibrillator, or ICD, to control the rhythm of her heart.
Really, in 2009, if we do it right, sudden death from this disease should really be the exception rather than the rule.
It's success like this that is driving genomic research even further.
The genomic floodgates have opened wide.
And researchers believe targeting specific diseases will give way to mapping an individual's entire genetic code, which could lead to a longer disease-free life.
We will have that. There's no question. We won't have the Human Genome Project. We'll have your genome project and mine, and there will be no genetic test in a dozen years for cystic fibrosis and long QT syndrome, because it'll all be on your genetic thumb drive.
Exactly when the personal genome project will be discovered is open to debate.
She likes rocks.
As for Sharon Brown, who lost both her father and grandfather at an early age to sudden death, she's thankful the gene linked to her family's deadly disease was discovered when it was.
I feel fine and very confident that I'll be around when I'm 56 and 66 and 76, so feeling good.
Sharon will receive the results of her children's genetic test within a few weeks, but she's already aware of options which will make treatment that much easier, Harry.
So fascinating. Any downside to this?
There's always a downside, of course. Genetic testing provides just one piece of the puzzle. It doesn't tell us how that genetic result will interact with things like the environment. So again, the results have to be interpreted. It's not just a matter of getting the results. And of course, there's privacy issues, and there could be even discrimination issues. So we're going to see a lot more of this in the future.
Dr. Jennifer Ashton, thanks so much.